How does liquid biopsy help SCC detection? Liquid biopsy aids in the detection of squamous cell carcinoma, particularly in the lungs, by offering a non-invasive method to identify tumor-derived genetic material or cells in the bloodstream. This innovative approach allows for early diagnosis, monitoring of disease progression, and detection of recurrence without the need for invasive tissue biopsies, which can be risky or difficult to obtain. One of the main advantages of liquid biopsy is its non-invasive sampling method. It analyzes circulating tumor DNA or circulating tumor cells found in blood or other bodily fluids. This is much less invasive than traditional tissue biopsies, making it a safer option for lung cancer patients who may have complications from invasive procedures. Another significant benefit is the potential for early detection and diagnosis. Liquid biopsy can identify specific genetic changes or methylation patterns linked to squamous cell carcinoma at early stages. This means that it can sometimes detect cancer before any symptoms or visible signs appear on imaging tests. Early intervention is crucial for improving outcomes and survival rates. Liquid biopsy also boasts high sensitivity and specificity. Advanced techniques have shown that these tests can accurately identify patients with cancer while excluding those without it. For instance, in studies related to human papillomavirus-associated squamous cell carcinoma, liquid biopsy demonstrated over 90% sensitivity and nearly 100% specificity. While this data comes from head and neck cancers, similar principles apply to lung squamous cell carcinoma detection. Monitoring treatment response and recurrence is another critical aspect of liquid biopsy. After surgery or treatment, it can detect minimal residual disease by identifying low levels of circulating tumor DNA. This allows for the early detection of relapse before it becomes clinically evident, enabling timely adjustments to treatment plans. Personalized molecular profiling is also a key feature of liquid biopsy. It can capture the genetic diversity of tumors by detecting multiple variants at once. This information helps doctors tailor treatment plans specifically for patients with squamous cell carcinoma, enhancing the chances of successful outcomes. However, there are challenges and limitations to consider. Liquid biopsy may not always capture the full complexity of a tumor, especially in cases where there is a low tumor burden or limited shedding of tumor DNA into the bloodstream. The sensitivity of the test can vary based on the technology used and the biological characteristics of the tumor. In summary, liquid biopsy supports the detection of squamous cell carcinoma by providing a sensitive, specific, and minimally invasive tool for early diagnosis, monitoring, and personalized management of lung cancer. It complements traditional diagnostic methods and holds promise for improving outcomes through better disease surveillance and tailored therapies. However, it is important to remember that liquid biopsy is currently an adjunct to tissue biopsy and clinical evaluation, and ongoing research is focused on enhancing its clinical utility in lung cancer care. Always consult healthcare professionals for personalized medical advice.